welcome back to the Pulsating Biology, where we were covering the topic transport in humans. This is our last chapter for this topic, and in this video, we are going to discuss about the possible risk factor regarding the heart failure. Number one risk factor that we are going to talk about is the stress. Plays a very important role when it comes to the cardiac heart failure, as we know that there is a hormone that is released that is most commonly known as adrenaline that rushes into their body. Next, we're going to talk about is the sedentary lifestyle. Our lifestyle impacts a lot on our body's life, and that's why we say that the sedentary lifestyle or the lifestyle you basically live in have a very important impact on the our heart failure. Thirdly, we can say smoking. Smoking is very injurious to health, and for a reason we say that the smoking basically impact our lungs that impact our heart. Fourthly, we're going to say is the age. Age factor is a big thing when it comes to the heart failure, since our organs become weak whenever we get aged. Fifthly, we're going to talk about is diet. Diet, for example, if you're having an intake or a lot of intake of some oily substance or anything that includes more of triglyceride, we say that there's more chances of you being a patient of a heart failure. Then we say gender. As when you talk about the gender, we know that the males are more prone to get a heart attack than the females. That's mostly because of the hormones that are released in their body. Sixth that we're going to talk about is the genetic predisposition. Genetic predisposition. What is meant by genetic predisposition is that sometimes the heart failure is in the genes of certain families or certain people. Those people are more prone to get the heart failure. These are some factors due to which the heart failure may occur. That includes the stress, the sedentary lifestyle, the smoking, the age, the diet, the gender, and the genetic predisposition. All of these plays a very important role when it comes to the cardiac heart failure. As we have talked about the factors that play a very important role applying the cardiac failure, now we can talk about the reducing the risk that basically become the cause of the heart failure. Number one is the diet. Diet, when you talk about the diet, the first thing that should come in your mind is the balanced diet. If a person is not taking the right proportion of all the nutrients in his diet, then the person may be prone to be the patient of a heart failure. For example, if a person having a more intake of a lipid or fats or the substances that have a lot of ghee or oil, so that those patients or those people are more prone to get the heart failure. So your diet should be very proper, and the diet should be balanced diet and not include a lot of lipid in it, not include a lot of lipid content or even the fatty acid content or any content that basically would include your cholesterol or the triglyceride. Alright, the next second big factor is the exercise, and by exercise I mean not the exercise that we do once in a month or once in a week. That means the regular exercise. The regular exercise basically helps your heart to pump more properly and your muscles in your heart to function even more properly. And that's why we say that regular exercise are very important for the people who are victim of heart failure and those who are prone to heart failure even. So these are the two reducing risk factor. Here we are done with the chapter. If you have any questions, you can ask in the comment section below. Thank you for watching.